All right, let's dive right into a really tough situation. It's one that, a lot of families and doctors eventually have to face. We're talking about that moment when a deeply personal freedom, the freedom to drive, smashes right up against a doctor's duty to keep the public safe. So, picture this. A daughter is talking to her father's doctor. Her dad's 76, and she is just so worried about his driving. But she knows that for him, those car keys, well, they're not just about getting from A to B. They're his independence, his freedom. It's a huge deal. And boom, there's the dilemma, right? What is a doctor supposed to do? They're caught smack in the middle, trying to balance the needs of a patient they've known for years against the safety of, well, literally everyone else on the road. So let's look at the actual case here. We have a 76-year-old man, and his family sees it. His reaction times are just not what they used to be. His judgment seems a little off, and it's not just them being paranoid. A clinical assessment backs it all up. The conclusion? It's probably not safe for him to be driving anymore. Okay, and this is where we have to kind of shift our perspective, because this isn't just a simple medical problem. The usual rules that guide a doctor, focusing on one patient, their privacy, their right to choose, they just don't quite fit the situation. The stakes are bigger. And this really lays out that core conflict. On one side, you've got traditional clinical ethics, where the doctor's number one job is to the individual patient. But then, on the other side, you have public health ethics, which zooms way out and asks what's best for the entire population. The focus completely shifts from just one person to, well, everybody. So why is this a public health issue? Well, just look at this number, 2,500. That's how many people are killed in car crashes in Canada every single year. This isn't some rare event. It's a massive, ongoing public safety problem. And to really put that into perspective, think back to the SARS epidemic in 2003. That was a huge public health crisis, right? It resulted in 44 deaths in Canada. Now compare that to the 2,500 deaths from car crashes every year. It shows you just how serious and persistent the danger on our roads really is. So, okay, when your old tools don't work, you've got to find new ones. And that's exactly what happened. Back in 2002, a bioethicist named Ross Upshur created a framework designed for exactly these kinds of situations, these messy dilemmas where personal freedom and public safety collide. He came up with these 4 key principles. You can think of them as ethical rules of the road for doctors making these incredibly tough calls. It gives them a clear path to follow. So let's walk through them one by one. It all starts with something called the harm principle. This is the bedrock of the whole framework, and the idea is pretty straightforward. The only time it's okay to interfere with someone's personal liberty is to prevent them from harming other people. That's it. So what does this mean for our driver? It means the risk of him harming others is enough justification to suspend his license. It doesn't matter if he disagrees. It doesn't even matter if we can't say for sure when an accident might happen. The potential for harm is the key. Okay, but just because you can act doesn't mean you go straight for the most extreme option. The next principle is all about using the least restrictive means. You don't use a sledgehammer to crack a nut. You have to start with the gentlest approach possible. So for the doctor in our story, this means the first move isn't picking up the phone to call the licensing authority. Nope. The first step is to sit down and have a real, honest conversation, explain the concerns, talk about the risks, and give the patient a chance to make the right call himself. And that leads right into the next idea, reciprocity. This one's really important. It says that if society asks you to make a sacrifice for the greater good, like giving up your driver's license, then society owes you something back. It's a two-way street. We have to help you out. So this means the doctor's job isn't just to say, sorry, you can't drive anymore. No way. They have a responsibility to help that person figure out what's next. How can they still get around? Maybe it's registering them for a community transit service or helping the family organize a driving schedule. It's about finding real, practical solutions. And the last piece of the puzzle is the transparency principle. This one's pretty simple. Everything has to be out in the open. No secrets, no backroom decisions. When you're making a choice that's this big, it has to be done clearly and honestly. In practice, this means the doctor is totally upfront about why they're concerned. With the patient's consent, they bring the family into the loop. They might even sit down and go over the official notification form together, line by line. It changes the whole dynamic from feeling like a punishment to being a shared, responsible decision. So what's the big takeaway here? This framework is amazing because it gives the doctor a clear, ethical roadmap. It justifies the decision. But let's be real, it doesn't make that gut-wrenching conversation with the patient any easier. The human element is still very much there.
Yeah, it's a guide, not a magic wand. It doesn't give you a perfect formula to calculate risk. It can't make a stubborn patient suddenly see reason. And it definitely can't magically create social services, like a new bus route, where they don't exist. It's an ethical map, but it doesn't solve all the real-world roadblocks.
When you really think about it, this whole framework just boils down to something we all learned in driver's ed. Defensive driving, right? The whole point is that you're not just driving for yourself, you're driving with a genuine concern for the safety of others. These principles are just taking that same exact idea and applying it inside the doctor's office.
And this whole thing really leaves us with a huge question, one that goes way beyond this specific case. It's a question for all of us in our own communities. Where do we draw that line between our own personal freedom and our duty to protect the people around us? It's a tough balance to strike, but one we all have to think about.